Last week, we saw a drop in cases, and this week, we're learning hospitals are seeing a similar trend with patients. 22 News reporter Kate Wilkinson sat in on today's news conference with Trinity Health New England to learn about what they're seeing firsthand.
Yeah, a bit of good news when it comes to hospitalizations here. They're saying that they're seeing a downward trend, and they're thinking that it's actually going to be sustained given how COVID cases have been. Meantime, Massachusetts changed how they display their COVID numbers when it comes to hospitalizations, now showing when people are hospitalized because of COVID or are in the hospital for other reasons and test positive for COVID. That data shows about 50% of what they call primary COVID patients, and the other half are described as incidental. Dr. Hussein told 22 News this shows how infectious Omicron has been, but its effect is much milder than the Delta variant.
While it is very contagious, it does cause milder symptoms compared to Delta. And in some cases, especially those that are fully vaccinated and maybe boosted, it may cause no symptoms.
Another thing that's been going down in terms of this pandemic is the positivity rate, that percentage of people who test positive for COVID who are tested. Now it's down to 15%. It was about the mid-20s when we saw things at their worst with COVID cases. But keep in mind, this summer we saw it at less than 1%. We're live in Springfield. Kate Wilkinson, 22 News.
Taking a look now at the latest COVID data from the state. The state's daily COVID cases have remained consistent the last few days, today bringing in just under 14,000 new cases. And you heard it from Kate, the state is changing how it reports hospitalizations. Either way, more and more hospital beds are filling up. As of today, more than 93% of all non-ICU hospital beds in the state are full. The 7-day positivity rate continues to trend downward, now sitting at just below 14%.